Hi, my name is Betty Smith, and this is the journal for Unit 7. And we just had the class, our lecture with Dr. White. Thank you so much, Dr. White, for your support. And so now I'm going to discuss the same patient that I had discussed in our seminar. My patient is a 59-year-old African American female. She's never been married. She's been homeless from the time period that we know for several years, at least 10 or 12 years, 10 or 15. She is schizophrenic and she's on Invigo. Um, about a year ago, her sister found her on the streets and brought her into her home. We also, from what the caseworker has stated, her sister also suffers with mental illness too. So, uh, but um, um, but both of them have been staying in this one little small apartment, and um, I call her Miss Lady. Miss Lady has been stable and staying in the home with her sister for at least the last 6 months. She has been consistent. Um, Probably around that time, 6 months ago, um, she was was seen in the ER and found out that she had a benign tumor in her belly. Now, because of her thoughts, she believes that she is pregnant and that those are not tumors. So she refused for them to go in and do any kind of medical procedure. She said she is pregnant. From what we understand, she's never had a child and that she got pregnant by alien and that she's going to keep the baby. But from also what when she was examined, I don't think she's I think like for a long period of time, she has not had any kind of sexual activities and she's post-menopause. So I think she's gonna be 60 in a day or two. But when the caseworker brought her in, she was pleasant and she just kept reiterating that she was pregnant. From what my preceptors have said to me, he states that this is as stable as she probably will be because when she first started coming, she was still combative and agitated. Now she can hold a conversation, not for long, before she will drift away, but then she will drift back and say, "Oh yeah, yeah, I just want y'all to, just know that yes, this, I'm saying, I know my belly, and I think I'm about 4 or 5 months pregnant." And so he said this is probably going to be her best normal. And the caseworker brings her to get her Invego shot. And then she's able to see the preceptor, my preceptor after that. She does not drive, so she's cooperative with the caseworker because the caseworker always promised her to take us to McDonald's. And so she looks forward for the caseworker to come and pick her up. And she's more cooperative in getting her shot because she said it does help her rest. And then, she's going to get some McDonald's and sometimes the caseworker even gets her some candy. But I think that's about it. And just checking on her and her just being stable. The other thing is, my preceptor did try to get in touch with the medical. I think she's like at the county hospital to see exactly what they're going to do because her abdomen is huge. It does look like she's pregnant, to be honest, which is like she's 6 months pregnant. And I think right now they're trying to get some kind of consent to maybe go in there with, what I'm saying? And, she refuses, but this, like I said, the sister's not stable, but they want to try to get some kind of consent to maybe go in there and remove remove the tumors because they are bothering her. And, but, she says it's an alien baby and she's going to keep it. Well, that's the end. She is precious. That's all I can say. But that's the end of that story. Thank you.